it's now time to acknowledge and celebrate a few of the many amazing nurses that we have in the room. We've got our APNA Nurse Awards presentation ceremony, the APNA Nurse Awards. You excited to celebrate? There are so many of you doing so many wonderful things. So please, I've just got one rule. When you are named as a winner, please don't kiss everyone in the room before coming on stage. Just concentrate on being humble and come quickly. We'll get it done. To present the awards, please welcome back to the stage your beloved leader, Karen.
I think the moving the footstool thing's going to keep Gary very busy today. Thank you, Jean, for that lovely introduction. Look, it's with privilege that I announce the APNA Awards for 2019. It's a time for recognition of efforts put in by primary healthcare nurses and acknowledging the exceptional achievements in the field. This year saw yet another year of higher quality nominations from across the country, and they're assessed by an independent panel. Many of the finalists and winners have continued to do amazing things, and you'll see some of the friendly faces here at our conference. Chris Helms, who's hiding over there, was our Rosemary Bryant Award winner last year, and some of you have already heard Chris speak already yesterday. And Carolyn Gibson, Carolyn, where are you? Hiding somewhere too. Will also be addressing concurrent sessions tomorrow afternoon and was the finalist in the Nurse of the Year category last year. It's exciting and heartening to see our award winners engage with APNA and continue to participate in education activities and advocate for primary healthcare nurses. The APNA Awards format includes the APNA Recently Graduated Nurse of the Year and the APNA Nurse of the Year. And I'll just tell you a little bit about those awards. The APNA Nurse and Newly Graduated Nurse of the Year are nurses who demonstrate leadership and excellence in the field of primary healthcare nursing, provide a voice on behalf of primary healthcare nurses, provide a voice and advocate on behalf of their community, and contribute to improve outcomes for patients in their communities. And over the past 12 months, this year we're presenting two prestigious awards also, the Rosemary Bryant Award and the APNA President's Award. And you all know Dr. Rosemary Bryant, Australia's first Chief Commonwealth Nurse, 2018 to 2015. She's the 26th President of the International Council of Nurses, 2009 to 2013, and everyone cuts that down to Chief Nurse of the World, which is her nickname. And in 2014, Rosemary was made an Officer of the Order of Australia. And from 2015, just when she thought she was almost going to retire, we nabbed her as Patron for our organisation. So I'll move on and we'll look at the awards for Recently Graduated Nurse of the Year. So the first award is presented to APNA Recently Graduated Nurse of the Year finalist. So this is the runner-up. Ellen Patterson. Ellen, would you like to come up close to the stage? Rosemary up to hand out the awards. And Rosemary, you can't stay there. We've got things for you to do. Well done. So while Rosemary's coming to the stage, I'll let you know a little bit about Ellen. Ellen's a registered nurse who's just completed her graduate year as a practice nurse at Hunters Hill Medical Practice in Sydney. Ellen is commended for managing her life as a mother of 4 children and studying a Bachelor of Nursing degree. Her clinical placements included placements in Broken Hill, New South Wales and Vanuatu. I never got offered Vanuatu as a rotation. As a mature graduate nurse, Ellen has shown excellence in learning and adapting new skills in all aspects of a busy nursing department in her workplace. Her dedicated attitude to work and attention to detail has improved her nursing skills to a very high standard. And we want to say congratulations, Ellen. Give Ellen a hand, everyone. And now the winner is. So I'm very happy to announce the winner of the APNA recently graduated Nurse of the Year. And our winner is Cara Ray Karma. Congratulations, Cara. And as Cara makes her way to the stage, she's a recently graduated nurse in second year, also doing the second year of her PhD, focusing on undergraduate nursing education and primary healthcare. Cara's involvement in primary healthcare nursing research demystified the process and inspired other early career nurses and primary healthcare professionals to consider this as a pathway. Cara has further demonstrated her commitment to advocacy for primary healthcare nurses by representing Australia at the Global Conference of Primary Healthcare Nurses in Astana, Kazakhstan in October last year. She was appointed to the World Health Organization Primary Care Young Leaders Network among 20 members. There were 2,000 applicants from all over the world who applied for those 20 positions. Cara is active on social media around primary healthcare nursing and has developed strong connections with research students and academics working in primary healthcare across Australia and internationally. And I just want to say what a fabulous achievement. Congratulations, Cara. And now we move on to the APNA Nurse of the Year. And the finalist award, the runner-up, the set is Susan McInnes. And Susan? Susan works as a lecturer and early career researcher at the School of Nursing at Wollongong University. In 2018, she graduated with a PhD for her research around collaboration between general practices and general practitioners. Over the last 12 months, she's led a revitalisation of the primary healthcare unit within the university's Bachelor of Nursing program, which has led to dramatic transformation in course content. Yay! And it was instrumental in ensuring the unit was delivered by an experienced primary health nurse across 6 campuses. Sue's work within the program on earlier sentinel research and around clinical placement of undergraduate students in general practice and primary healthcare settings. And congratulations to Sue. And now the winner is, for APNA Nurse of the Year, Meryl Jones. Congratulations to Meryl. And as Meryl makes her way up to the stage, Meryl is a nursing unit manager at the Mater Refugee Health Service in Brisbane. She's maintained a specific interest in providing care for people from culturally and linguistically diverse backgrounds, and throughout her nursing career has worked in a variety of clinical settings in Australia and overseas, including the UK and remote Aboriginal communities in Queensland, Papua New Guinea and East Africa. Meryl has worked with people of refugee backgrounds in primary healthcare for 5 years, and she's passionate about health advocacy, improving access to quality primary healthcare for refugees and asylum seekers. Her direct patient service informs constant quality improvement, and Meryl is able to use the observations and data collected by her team to continuously improve processes and patient care. In collaboration with one of her nurses, she's developed best practice guidelines for immunising a person of refugee background, and that is presented both orally as well as through poster presentations. So congratulations, Meryl. Please give Meryl another round of applause. So now I'm going to tag team with Rosemary, and Rosemary, as we move on to the Rosemary Bryant Award. So I'll move away and let Rosemary take the stage.
Moving furniture. Good morning, everyone. So it is with a great honour that I will be presenting the Rosemary Bryant Award today. It really is very heartening to have an award named after you, I have to say. And I thank APNA for their ongoing support of me, and being a patron is also a great honour. So, the winner of the Rosemary Bryant Award this year is Judy Wicking. And you might have noticed Judy before when Jean was calling out how long people had been in primary health care. Judy was one of the last women standing. In 2001, Judy was approached by the then Whitehorse Division of General Practice to develop and establish the nurse-led asthma clinics in the general practice program. By 2007, Judy began working for the National Asthma Council as their project manager for the GP and allied health professional asthma education program. This job, together with the continuing to conduct asthma and respiratory clinics in 5 general practices, was the most personally and professionally rewarding time in her career. While working with the National Asthma Council Australia, Judy spoke about asthma management at conferences both here in Australia and internationally. Over time, Judy's interest in how asthma educators working collaboratively with general practitioners to help patients with chronic respiratory health needs grew and led to several published research studies. Judy retired from the National Asthma Council last November and is now semi-retired, continuing one nurse-led asthma and respiratory clinic along with other consulting work and enjoying time with her grandchildren. Would you please congratulate Judy?
Thank you seem just so inadequate, really, but I can't thank the community of primary care nurses enough, and indeed Karen for her leadership, for Ken, for the board, for the work that they do that we don't often hear about the board, but they work tirelessly for this organisation. When I made the decision to leave hospital nursing for community primary care, general practice nursing as it was then, in 1977, yes, I was very, very young, and I had no idea that that decision was going to change my life so dramatically, but more importantly, it was going to give me such a personally and professionally satisfying career. What a privilege it is to care for people from cradle to grave. We are indeed privileged, and our work will always be there. We'll never be without a job. But you can't have such a career without the support of many people. And I acknowledge so many of my dear friends and colleagues throughout that journey. My partner David, who's sharing with me today, and also Mark Gordon, who's been just so encouraging. It also highlights to me how important mentoring is. Find a buddy. Get alongside somebody, be supported by them, but you support somebody else, because having that support and encouragement in sometimes a challenging role is just invaluable. So I sincerely wish all of you primary care nurses who are specialist nurses in their field the very best, and thank you all so very, very much. Thank you, Rosemary.
Sorry, a bit of reorganisation. Thank you and well done for Judy. Now, the next award isn't given out annually, the President's Award. And the President's Award, I find my little piece of paper. It's a highly prestigious award and honours an individual who's made an outstanding contribution to primary healthcare nursing. It's a discretionary award, and the APNA President selects their winner and is approved by the board. And for the President's Award for 2019, I'd like to welcome Rosemary Windsor from the West Australian Primary Healthcare Nurses Association to the stage, please. Now, I've known Rosemary kind of loosely for about, well, easily 10 years. And Rosemary is a registered nurse, as we said, working in general practice in Western Australia. And Rosemary is a quiet achiever, and she's been supporting a thriving nursing network in Western Australia almost single-handedly for a number of years. So Rosemary's been involved with WAPNA for over 20 years in a voluntary capacity. In positions such as Education and Liaison Officer, and during that time she was President from 2012 to 2016. She's been Secretary for the past 4 years and has shared Treasurer's, President's and Vice President role. All at the same time? Sometimes. So Rosemary's also participated in many working groups and programs over the years, with some of the more recent ones being the Nurse Ambassador Training program with the Heart Foundation in 2016. She also participated in APNA's Career and Education Framework in 2016 and Drug and Alcohol Working Group called Tadpole in recent years. Rosemary believes that networking and working together with other nurses groups, professional groups and primary healthcare networks is essential to improving overall outcome of health benefits for the community. She's passionate about nurses being provided an opportunity to gain knowledge in their area of work, and as a result, she corresponds with many primary healthcare professionals and enables the networking for the benefit of others. So well done, Rosemary.
Hi everyone. This was indeed an honour to receive this, and I was totally shocked and surprised because I just, just do what we do with WAPNA. And when Ken rang me, I really was speechless, as he could remember probably. I just believe I love learning myself, and I feel that just learning in all avenues, in all areas. I've worked in rural settings, corrective services, and in general practice, and a lot of settings, and that's helped me to learn to adapt to situations. And I feel for the nurses in WA, we are quite isolated, and I do like to particularly look after our rural nurses, and so we provide videos where we can of conferences as well. And I think we all need to work together. The more informed we are, the more informed then we can make our patients and help them for their self-management of all their chronic conditions, etc. And then I think we've got a better community, and then it can just extend from there. And I just think it's been great working with people, and even I have worked with Judy as well, organising lots of different events in WA. We are, as I've mentioned, isolated, so newsletters of what's going on in communities from other organisations. I like to distribute all those sorts of bits of information, and I think you've heard enough from me for now, but I have got little things I'm planning on doing myself to try and have little areas of information for people as well. And so thank you very, very much once again, and thank you to APNA for this honour. It was really, I'm really humbled. Thank you so much. Thank you.
And you deserve it. Just about. Yeah. So congratulations to all our award winners for achieving amazing things, and what was that word again? Potentialisers, and using their skills to potentialise others. Just before I go, it might be worth mentioning the beautiful glass trophies, and we had given an award to Chris last night because he missed being with us last year, but the glasses are locally made by a local artist in APNA colours, especially for us. So thank you everyone, and I'll hand back to Jean.
Ladies and gentlemen, what an amazing ceremony that was just then, a recognition of amazingness that is already happening in your nursing community. So would you please give a congratulations to our winners. I'll start with our recently graduated, our finalist Sue McInnes, our recently graduated winners Carrara Ray Kalmer and Ellen Patterson, our APNA Nurse of the Year, Meryl Jones, our Rosemary Bryant Award winner, Judy Wicking, and our President's Award winner, Rosemary Windsor. Just give them all a round of woohoo! Cheer! Woo! Oh, I thought I had to fill while the chairs came on, but they're here already. That's pretty good. Oh, nearly all of them. But it is really important. I'd just like to say, to recognise, if you recognise your own community, then the community is going to recognise and value you even more. And you're going to teach us all to do that.